Anyway, Jenny Brannigan is in now. She's a physiotherapist. Jenny, you're very welcome to the programme.
Thanks, Derek.
Lots of emails coming in so far, talking about sons and daughters and granddaughters and grandsons and all that kind of stuff. Maybe people are a little bit embarrassed, do you know what I mean? To come on and talk about their own conditions. But as I'm not, and I like free advice, let's start with the groin, Jenny.
Right, okay. Well, what do you want to know, Derek?
How do I cure it? Because I recently had the problem, as you know.
Okay, well...
So I got a bad groin strain. I was in the gym,
yeah.
And I was doing the wrong... well, I was doing the right exercise,
yeah,
but I was probably doing it the wrong way, or I had too many weights on it. So can you explain? Because it's a very common injury, isn't it, the groin strain?
Oh, absolutely.
We hear a lot about it.
Absolutely. Well, what exactly did you do, Derek? How did you actually hurt it?
Well, there's a machine that you you sit on a machine like this, and you push your legs apart. You spread your legs apart, okay? You're in a seated position, but you're spreading your legs apart, and it's for strengthening the muscles. I presume your butt muscles or your thigh muscles or your groin muscles or something like that.
It's important you know what muscle you're trying to strengthen when you're doing it.
Oh, yeah. But anyway, it started to shake vigorously, like I was on a ferry coming from Holyhead, and you know the way occasionally you feel that shaky thing, and I stopped, but actually the damage was done, and I've pulled my groin. I got a groin strain. I never had one before in my life.
Well,
and they are sore.
Yeah, the most important thing to do with a groin strain is to ice it immediately. You need to make sure you get ice on it, but very importantly, you cannot stretch it at all for about the first 5 or 6 days, and that's a mistake that a lot of people make. They try and stretch it out. They try and just, sort of ease it out themselves. But the key thing with any groin strain is to make sure that you actually stretch it and rest it and do nothing else with it for about the first 5 days, because studies have shown that actually if you stretch it initially in the first few days, you can do more damage and it can lead to really much more problems, so that you could be out for a couple of weeks or even a few months with it.
What exactly is it, though?
Basically, it's a tear in the muscle fibres. Depending on how much pressure you actually put through it, you can tear a small amount of muscle fibres or you can tear quite a large amount. If you were trying to push a weight that's too much for you, that you're not used to doing, maybe it was the first time that you actually, did that exercise or whatever.
Well, it had been for the first time in about 20 years, yeah.
Right, okay. So basically the muscle wasn't used to that, it wasn't expecting it, and the muscle actually tore under the force of the weight. So, basically it's a tear. So you get a lot of inflammation into the area then. The inflammation is what causes the pain, because you get inflammation that presses on the little nerve endings that are in the muscle. You get a bleed into the muscle, so that's what's going to cause the bruising then that's going to happen. So your main aim at that time is to try and minimise that as much as you can. So you want to ice it as quickly as you can and rest it from any further aggravating activity. So oftentimes you might be limping with it, you mightn't be able to walk with it, you can sometimes get pain going up into your back with it. All of that you need to rest and just really try and take the pressure off it in the first couple of days with it. As I say, ice it and no stretching for the first couple of days. And ideally, if you can get some anti-inflammatories, you see your local doctor within the first 24 hours if you can, and see your physio probably within about 48 hours.
Well, as soon as I realised I was in pain, I went onto the internet, as you do, and I read as much as I could, knowing it was the groin area. I thought, oh God, this is sore. Yeah. And there were 3 stages or 3 different sorts of groin strain. There was one which was a kind of moderate pain, which you could nearly walk off or run off.
Yeah,
and
exactly.
Then 2 was a more lingering pain which caused you trouble if you're walking, and then 3, which was the most severe, was this: if you have pain at night, which I had, I couldn't sleep at all, pain when standing, which I had, I couldn't stand. My goodness, it was so bloody sore.
So all of that relates to, it's basically describing how much of a tear there is in the muscle, a grade 1, a grade 2 or a grade 3, and depending on the symptoms that you have, it'll tell you how long the problem is likely to go on for.
Well, of course, I immediately assumed I had grade 3, which was the tendon's been pulled right off the bone or something like that, isn't it?
Well, it feels like that certainly in the initial stages, but often you'll find that once you do the right things for the first couple of days, it'll settle down quite quickly, much quicker than you actually expect. So, the key is just to make sure you do the right thing within the first 24 hours, and you'll minimise a lot of that pain, and you'll be up and running, well, not running, but you'll be up and moving around much quicker than you expect then,
Rice, rest, ice, compression, elevation.
Yeah, absolutely.
That's what it says. First sign of anything, rice, rest, ice, compression, elevation. Because when do you use heat and when do you use cold?
Well, if you
have
if you have an acute injury, as in a sudden, dramatic, like what you had with your groin, really sudden pain, really, really sore, you never ever put heat near it, because you'd want to try and minimise the inflammation that's there. If you put heat near it in that instance, what's going to happen is you're going to increase the blood flow to the area, which will cause more inflammation and swelling. So with any sudden sharp pain, any sudden twisting, any sudden pain that happens while you're doing a movement, you always ice it for the first, they say up to 72 hours. You never put heat anywhere near it. And actually they say that you should minimise, you shouldn't go drinking basically, you shouldn't have any alcohol at all at that time, because that can increase the swelling as well. But ice is the most important thing.
Why does alcohol increase the swelling?
It increases the blood flow to the area.
But it eases the pain. Well, it does. It takes your mind off it.
It takes your mind off it, but officially you're meant to just put ice on it. And, so if a rugby player, tears a muscle during a game, they're not meant to go out and have a few drinks.
What about Gordon Darcy? Didn't he? He had a very bad groin strain, didn't he?
Yeah, he did actually. He had a terrible time of it. It was I think it was about 2 years ago now. They went over and they were using this cryotherapy over in Skala in Poland at the time. Himself and Brian O'Driscoll, actually, he had a hamstring problem at the time. So, yeah, he had a terrible time with it, really. I think it recurred since as well, actually. But the key with a groin, it's a terrible injury, actually, to get. You have to look after it first and foremost in the first few days. And basically, you don't stretch it in the first 5 days. That's the biggest message that I would give on a groin strain. Ice it and no stretching.
Now, are you in favour of ice packs or ice patches?
I personally prefer ice, but to be honest, whatever you have handy. Anything that you have that will deliver cold. Ice pack, frozen peas, bag of cauliflower, whatever you might have. Ice patches, anything.
I made a terrible mistake. I used the mushy variety.
I hope you didn't eat them afterwards, did you?
No, I actually used the ice pack, but it's actually quite cold on the leg.
Yeah.
So,
well, I'd recommend that you put maybe a J-cloth or something between the ice and your skin.
Stuck it into a pillowcase.
Yeah, that's a good idea because it's quite a sensitive area. The skin is very sensitive, so you want to make sure you don't get an ice burn. It depends on who you read, but they usually recommend not putting the ice on for longer than about 10 or 15 minutes. Some people like to leave it on for an hour, but I've seen people get ice burns and it's quite dramatic. You get lots of scabs and cuts and all that sort of stuff. The skin just breaks down. So 10 to 15 minutes with the ice maximum, but you can do that a couple of times in the day.
Now you're working with the ladies soccer team, the under-19.
That's right, the Irish under-19s women's soccer team.
And you were away last week, were you?
We're going next week. Actually, we were working at the weekend. They played Russia in 2 friendly matches. They beat them on Friday 2-0 and they beat them yesterday or on Sunday 3-2. So this is all in preparation for the UEFA Elite Phase qualifiers, which are on in Madrid next week.
Very good.
So basically we play Spain and Holland and Serbia next week in Madrid in an effort to get to our first ever finals, which are on in France in July. So they're doing fantastically well at the moment. They played Iceland 3 weeks ago in a friendly match and beat them 8-0. We did a training camp in the Algarve at the start of March, so they did very well at that. So they're really, they're on a winner at the moment. So we're really hoping now next week that they'll top the group.
So they must have all sorts of injuries. What are the most common injuries?
The most common injury that you see is really ankle sprains. It's the most common injury the world over. But you get it a lot in soccer, particularly with these sort of little dummy passes that you see them trying to, sort of dribble the ball past an opponent, and the foot, it sort of hits the outside of the foot, so they're quite at risk there to just go over on the outside of their ankle. You see a lot of foot and ankle injuries, really, like these blocking passes. They tend to hurt themselves doing that as well. They can get medial ligament strains in the knee, which is the inside part of their knee. Hamstring pulls are quite common as well with soccer. If they're really hoofing the ball into the goal, if they're taking a really forceful shot, the impact to the hamstrings is quite considerable, so they can really hurt themselves doing that.
Explain that, the hamstring pull.
Okay, the hamstring is basically the muscle in the back of your thigh. So when you're kicking the ball very forcefully, actually all of the force goes through your foot. But what happens in the hamstring muscle, as your leg is slowing down, so you basically don't kick yourself in the head, you get a contraction through your hamstring muscle that stops the follow through of the leg. So it puts quite a strain through the hamstring muscle. So it can be quite common to see sort of tightnesses in the hamstrings and, kind of strains and that sort of thing happening in the hamstring muscle.
Is that a nice treatment that you would start with there?
Ice.
No, I'm sure it's a very not nice.
It's not very nice, but yeah, ice would be the thing you'd do there straight away. With any acute injury, as I say, anything sudden pain like that, you'd put ice on it straight away.
And how do you know where the pain is sometimes? I mean, it sounds like a silly question, but you picture a diagram of the human skeleton.
Yeah.
And then you go in there and then you've got all the muscles and tendons and everything that are attached to those bones. There's another diagram there.
Yeah.
And then you go and you look at, then you've got your ankle and your foot and there's another diagram there. And then you've got the nervous system. There's a whole other diagram there. How do you know where the pain? Because it's very hard sometimes where to pinpoint exactly what the pain is for the patient I'm talking about now. I find this problem. And then where exactly it is. And then how do you know which bit to manipulate?
Well, a lot of it comes from experience. When you've been working for a while, you start to see patterns like that. So when they come in and describe exactly what happened, you'd already be thinking, right, well, this sounds like, something I've seen before. So, you might be describing your groin strain and I'd be thinking, right, well, we need to, check a particular area. We need to look then at that point for why this might have happened. So it's not enough just to be looking for exactly where the pain is. You have to try and figure out why it actually happened. So a lot of times these pains will happen because the muscles are weak and you have to figure out, well, why did this happen? What was the previous cause of it? Because if you just treat exactly where the pain is, you might miss, the bigger picture. So the problem could end up recurring and coming back down the line. So a lot of times you need to check sort of the joint above and the joint below. You need to check the muscles that are surrounding it. You need to check, there's like what they call antagonist and agonist muscles where they basically work together. So if the muscle at the front pulls, the muscle at the back is lengthening. So you have to check and see if there's an imbalance between those two muscles. So, for example, in the example of your groin, where the groin muscle pulls at the front, oftentimes it's because the butt muscle has switched off on the other side. So that's getting very weak, and the groin muscle has to basically take all the force, and the body compensates by using that. So there's a pattern that you really tend to recognize. And when the person is describing the lead up to the injury and how it actually happened, you're thinking, well, what might have caused this? And that allows you to identify where the problem is, and you start pressing then into those areas where you feel you need to check.
You were saying to me before that some people suffer from muscle imbalance.
Yeah.
Explain what that is exactly.
So basically what I was saying there, if you have a muscle basically that pulls on one side, it's going to lengthen on the other side. So if your quadriceps shortens on one side, the hamstring has to lengthen on the other side. So your quad is the muscle on the front of the thigh, the hamstring is the muscle at the back of the thigh. So as one shortens, the other lengthens. And if you get an imbalance between that, shortening and lengthening reaction, one muscle starts to get more stress through it compared to what it should have. The other muscle then again has to compensate for that. So where the muscles are supposed to have an equal relationship, one starts doing more work and the other one starts to weaken then in relation to that. So the body is fantastic at compensating, and it'll do that for quite a while until there's just too much stress on that one muscle that's bearing all the brunt of the exercise, and it'll start to break down. So a lot of these injuries that seem like they're acute and they've come straight out of the blue are actually injuries that are gradually building up for months or even sometimes years. They're often years in the making. So, when somebody comes in and talks about their problem, you have to figure out, is this something that's totally out of the blue, or is this something that's been leading up to it over the past couple of months?
Let me read out some of the emails that are coming in.
Okay.
Bob has been on to say that his grandson, who's 15, pulled a hamstring on Saturday playing rugby and has been out of school, if you don't mind.
Lucky grandson.
Can he move around? Could he go to school, Bob wants to know, without doing any further damage, or does he just have to stay at home and rest? Okay,
well, certainly I wouldn't be recommending that he needs to stay off school with that. Again, he needs to get back to this RICE protocol: rest, ice, compression, elevation. Certainly he might be limping with that, but it's very important that he gets that seen straight away, because if he's sort of lying up in bed and resting and doing nothing, what will happen is he'll actually end up getting tight through that muscle. He needs to get ice on it for the first couple of days. We need to start gently stretching that and start to actually work into that, kind of after 4 or 5 days, to make sure that the muscle fibers are healing as they would normally do, and to get him walking as quickly as we can, try and get him walking as quickly as we can, so that basically he's not tightening the muscle overall.
Not to do you out of any business, Jenny, but why couldn't I just go and get a massage?
Well, if you were to get a massage in the acute phase like that, you could actually do more damage, because basically you've got a lot of blood in the area, you've got inflammation that's happening there, and if you get somebody really deeply massaging into that area, you'll actually do more damage. You'll cause a lot more bruising, and it'll actually damage the muscle fibers that are just trying to heal at that stage. So you need to rest it, you need to protect it, you need to ice it.
No, but instead of going to the physiotherapist, why don't you just go and get a massage? That'd be nicer, relaxing.
Well,
probably
actually,
cheaper.
I don't know about cheaper, but certainly it's not the right thing to do, because you need to make sure that you have to appreciate what stage the healing is at. So at that stage, everything is after tearing, you've got a lot of trauma in the area, and you have to have somebody that really appreciates that. A massage therapist is somebody that's used to kind of working out and kneading out the muscles. They're not there at the acute phase, and they don't usually treat acute injuries. So you need to get to a charter physiotherapist who's used to dealing with that and who knows what to do in each phase of the rehabilitation, and you need to make sure that you're getting the right thing done from day one, because really the first 48 hours is the most crucial phase for any injury, and if you get a massage straight off, it'll actually cause more damage. Now,
one of the little kind of things that niggle me, apart from the various creaks and pains that I have, is having to go to a doctor before I can go to see somebody else, a specialist. Could I walk into your place and just...
Yeah, absolutely. You don't actually have to go to a doctor first. Basically, you can just give us a call.
Is this any physiotherapist?
Yeah, absolutely. Any chartered physiotherapist. You can just look them up in the phone book. You can look them up online, and basically give them a call, have a chat to them, go into them straight away. You don't need a referral from a doctor or from the hospital or anything like that. If on assessment the physiotherapist feels that you need further investigation or anything like that, they'll certainly send you on to the appropriate physician. But it's not necessary to see anybody first. You can just give us a call straight away.
Okay, Juliet's son, his 5, gets a lot of creaks in his neck, and this can happen at any time during the day. She says, is there anything she can do to ease the pain? Oh, they're a bloody nuisance, creaks.
Yeah, they are terrible. Well, certainly he's very young to be getting those, isn't he, really?
That's what she says here.
Poor little fella. Well, basically, I would recommend that he gets that looked at, or that she gets him looked at, because, he's only young. He shouldn't be getting pain like that at that stage in his life. Possibly he's sleeping in an awkward position, or he might be sleeping on too many pillows or anything like that. But it's very important that she gets that checked, because he's only 5. He's too young to be getting pain.
What are they exactly anyway?
A crick in the neck.
Yeah. Well, I know I've had them, but what exactly is it?
Basically, what happens in the neck is you either get a muscle spasm, a severe muscle spasm, where the muscle tightens. It's like a cramp in your neck, basically. Yeah. Or you can get a locking of the joints in the neck. So there's sort of 2 types that you can get. But it's a very dramatic thing, and it feels like agony for the first 2 or 3 days. But if that poor little fella is getting them very often, he needs to get that checked, certainly. And he doesn't need to see a doctor about that. He could go to see a chartered physiotherapist, certainly.
Hi, Derek. Would you ask Jenny what she thinks of orthotics for feet? Do they help? Is it better to go to a physiotherapist or a podiatrist?
Well, orthotics are basically, well, to simplify them, they're essentially arch supports. A lot of people are suffering with flat feet. Well, they're not suffering with flat feet, but flat feet is quite a common phenomenon. And as a result of flat feet, and maybe people who do a lot of walking or sport or anything like that, there's a lot of stress that goes through the joints, like the ankle, the knee, the hip. It can even go up into the back. And basically what orthotics are they're devices that are put into the shoes to try and support the feet so that the normal weight-bearing line is maintained, so that there's not too much stress going through the inside part of the foot, and that there's not this extra stress going through the whole leg and causing basically a problem at the point of least resistance. So I would absolutely recommend orthotics if you're the right candidate for them. You need to go to somebody who knows what they're talking about as regards orthotics. Not every physiotherapist is going to be used to dealing with orthotics. I would certainly recommend a physiotherapist to deal with orthotics, because usually people are looking for them when they actually have an injury, so you can do the 2 at the same time. But certainly they can work very well when they're absolutely needed. But not everybody needs them. You need to get yourself properly assessed for them. And if you were going to a physio, you'd ring them up and ask them, do they do a biomechanical assessment? And do they do orthotics? Because, as I say, not everybody does them.
Okay. Jenny, staying with us. Our number is 1850 715 900. You can email Mooney at rte.ie or send a text message to 51551. And hopefully before 4:30 we'll get to as many as we possibly can. So 1850 715 900.